Welcome. Thanks for taking time out of your Friday afternoon to join us for the inaugural Take 30 Research Town Hall platform. I'll tell you more about Take 30 in a couple minutes, but I'd first just like to share with you the agenda that we will present today. So we will share with you a significant number of metrics that have been developed by the Office of Research. Heather Offhouse from our Grants and Analysis Office will be presenting that. And Lisa Prossert from the Faculty Affairs Office will share with you some of the exclusion and family support, or COVID exclusion and family support. But first, I just want to start by giving you all a shout out and a huge thank you. We clearly owe all of our staff and scientists in the biomedical research community a huge thank you. You've been terrific over this last year, and as shown by this short video, you have not been resting on your laurels. You've been extremely active, and for that, we are extremely grateful. As shown in the next slide, the Take 30 platform is a new communication tool that the Office of Research is launching. It's designed to only last 30 minutes. It will always be focused on a particular topic with a presentation followed by significant amount of time to ask questions followed by some answers. We would really like you to help us come up with the topics that you are interested in having presented. We have a number teed up of our own. And if you want to submit a topic in the question and answer Zoom today, or email us at the email address here. This will be on a recurring basis. And again, it's just to be a fairly pithy mechanism for us to relay information and to share ideas that the research community is offering. So I'd just like to cover a couple of timelines. It's hard to believe that we are approaching a one-year anniversary of when COVID struck. March 14th, in one short month, is when we paused our research study. followed by 6 days later of ramping down our research efforts, which stayed ramped down for approximately 2 months. Our last research building was reactivated, as you can see, in June 18th, which was followed by activation of some of our research subjects. And I have to underscore, not all of our research has yet returned to campus. Where are we today? Well, our wet bench research, as many of you may know, is only ramped up to 60% capacity with mandatory mask wearing and mandatory social distancing. And you'll see in a minute that these mandatory requirements are working as it permits us to continue our research efforts. Human subject research for Tier 1 and Tier 2, and a subset of Tier 2 have been activated, but we're still waiting to activate our observational and benefit level 4 clinical trials. I can tell you that the Office of Research has been working very closely with the University of Michigan Office of Research and Rebecca Cunningham, the VP for Research, to increase wet bench capacity. And I would just ask you all to stay tuned for a communication from Rebecca's office that'll be coming next week as we potentially address ramping up further our research activities. Next slide. I have to again thank you for stepping up and meeting the challenge. Our environmental health and safety group, who conducts unannounced visit, keeps very close track of how we're doing. And as you can see in this pie chart, that we are at a high compliance with all of the mandatory requirements and safety issues that we need to adhere to. As you can see by this pie chart, 88% in compliance with COVID precautions. We've basically had no laboratory transmissions when all of our COVID precautions are followed. There may have been some community-based acquired virus infections that were brought into the lab, but we have not had one case of a lab-to-lab transmission when following our COVID precautions. Next slide. So despite a challenging year, as was shown in the video, you have achieved much, and we offer you great thanks. Next slide.
Steve, thanks for having me here today to talk about some of the data. I wanted to start off, and we have already had some chats maybe about this data that I can address. We have maintained what we think is our top 10 NIH rank. You can see in the right-hand picture, the left-hand picture, that our market share continues to grow. And in the right-hand side, you can see those we are in good company with. We are very close, if you see the dollars, to the 11th ranked University of Pittsburgh. There was a question in the chat about the Blue Ridge announcements. I will tell you that the way the medical school handles the rankings is to take the data straight from the NIH as the NIH publishes it. Where we do know that Blue Ridge does some modifications to their data before they publish their version of the rankings. So this is based on the NIH published awards in their frozen data set in January of this year. As we continue to grow in market share, which is actually probably more important than rank itself, we wanted to kind of recognize some of the departments that have been enjoying the same sort of success. In the basic sciences, CDB, physiology, and pharmacology have all seen significant increases in their market share over the same time period as that tail end of the picture. Psychiatry has also increased significantly in the last few years, and surgery continues to maintain a high market share. So we have many actual departments in the top 10 of their individual units, and we're happy at any point to share that information for those that are interested. We encourage that reach out to us. Could we go to the next slide, please? And when everyone got sent home and got told to do productive research work at home, right, you did. We saw publications go through the roof. Even in the opening video, we had one number, and we've even updated that number even more recently because publications continue to, for calendar year 20, continue to show and produce and count. And through May of this year, usually we see it stabilize out. So even though we're at 13.5% higher at this point, we expect that still to climb more. And we look forward to reporting back on that number as it starts to stabilize later this calendar year. Next slide, please. And while all the research was going on, our communications group in the Department of Communications, Kelly Malcolm, provided us a list of studies that were highlighted and shared with the community. These are the report outs that have had the most blog hits, looking at these different topics and really reaching out to our community and helping provide good, solid information about research that's going on, both COVID related, like life after COVID-19 hospitalization, all the way through is there a replacement for exercise? So these are things that our community enjoys and values receiving from us. And so thank you for continuing to put out high interest areas of publication even to the community. Next slide, please. We also talked about the number of proposals going into external sponsors to help support research skyrocketing again last year. We enjoyed another great jump. We can say that 153 of those projects focused on COVID, but we saw 3 particular months where we had significant numbers coming through the system to request funding to pursue research interests. In 3 months alone, we saw each of them at 25% more than they have been previously. Next slide, please. And some of the things we wanted to talk about was our recovery. As you look, these are pictures of our accruing studies on the left, handled by our CTSU. If you look at that left side and look for the yellow dotted line, you can see how we dramatically dropped off the number of accruals as research, clinical research closed down, and then how it has really pulled straight up at the end of last calendar year. On the right-hand side, even as important to watch is the number of completed visits. Those have dwarfed what happened in 2019. So we're very proud of our researchers is that they have come back, retained their accrued studies, and really pushed that forward. Next slide, please. And finally, we're going to take a little look at expenditures. We know that as research happens, it does cost. We watch those financial numbers. This is a combined number of both externally sponsored and internally funded expenditures related to research. Similar to most of the story of calendar 20, you can see drop-offs compared to 2019 once we hit March, and that we started to recovering there at the last quarter of the year with expenditures. If we go to the next slide, we are happy to report that salaries in general stayed pretty on par with previous years, with the big story being, of course, in the supplies and services. Also, we saw great drops in travel, any kind of research support for professional development. All of those were expected underneath the recovery plan. So as we see research ramping back up, we hope to report that these trends continue, that we keep recovering. So Steve, I'm gonna turn it back to you to take a look at some of our recovery initiatives.
Thank you, Heather. So the Office of Research has been actively assessing how we can help with research recovery. And we have a number of examples under consideration, and I'll show you a slide of actions that we've actually implemented and have taken. But we are very interested in assessing need-based support for our acute research hardship. Those research hardships that really have occurred over the last few months and are directly related to the impact of COVID. We've come up with examples such as helping support the purchases of animals, the long duration of costly research projects that may have been interrupted. We heard terrible stories of individuals that were 3 or 4 months into a 6-month study that decided to sack the whole study because of the COVID ramp down. We really want to make sure that we can help restart those studies. We wanted to assist the replacement of costly commodities that may have been outdated, chemicals, reagents, and some of the instruments that need to be reactivated. We are very interested in trying to help support this. Shown in the next slide are some other examples that we've started to consider. In the next slide. And that has to do with our funding mechanisms over the next year to year and a half. For example, we know that we could provide bridging support to allow an individual to miss a cycle or two just to generate the preliminary data that is needed to support an active grant going in. I've written a lot of grants, and I understand the need for generating preliminary data to support the hypothesis that you're working at. We want to look at the potential to provide up to 6 months support for our junior faculty members who have maybe exhausted their startup funds, and how we can actually supply some salary support to them to keep them active and going. And the same with regard to facilitating research that was paused because our clinical faculty had to be in the clinics to help support and take care of COVID patients during the last 6 to 8 months to support them. And finally, we had an idea of supporting those individuals that needed to stay home to either take care and provide elder care, child care, or spousal support. We'd like your ideas with regards to supporting that. And as shown in the next slide, the Office of Research has actually stepped up in how we've tried to help mitigate some of the impacts of COVID. We've provided significant support funding for our biomedical research core facilities and ULAM by putting funds in to mitigate the debt that is accrued. This will enable our recharge rates to maintain stable. We won't have to increase our recharge rates significantly. Central Campus governs these, and once you've reached a certain debt, Central Campus mandates that we increase our recharge rates. So we've mitigated that potential threat. We've extended central funding to a number of our CTSUs, our clinical trial support units, so we could keep ongoing with regards to our clinical trials and clinical studies that we have activated. We purchased a QC instrument for our advanced genomic core to increase the output as the demand significantly ramps up. We provided PPE with regards to masks and face shields for our graduate and master students entering their rotation so that they can sit close to their faculty advisor learning new techniques. In partnership with the Endowment for the Basic Science, we've helped fund the $500 bonus for our postdoctoral fellows. And we continue to advocate for tenured, our postdocs and our graduate students extensions as needed. And we've always been a big advocate for family care and support. And as shown in the next slide, I'm going to turn this over to Professor Prosser, who's going to tell us about our family support in the COVID exclusion year. Lisa?
Terrific. Thanks so much, Steve. I really appreciate the opportunity to provide a few updates from the Office of Faculty Affairs. So first, starting with the Family Care Task Force, which was first convened in July of 2020, following the recognition of the many challenges being experienced by faculty, staff, and learners during the pandemic, and especially those with family care responsibilities. The task force designed and fielded a needs assessment survey and data collection task in August of last year, with a 21% response rate from the approximately 30,000 faculty, staff, and learners we have here at Michigan Medicine. 89% of the 6,500 survey respondents, not surprisingly, reported some disruption with family care arrangements. And the survey also documented the high numbers of our community members experiencing burnout, reduced productivity, financial stress, and increased inequities. Throughout the fall, the task force has made a series of recommendations, and more details are available at the link in the chat box. But just to summarize a few of the initiatives that are currently being implemented, these include continuing support for flexible and off-hour work schedules and arrangements, continuing work from home arrangements to the end of March and likely through the end of August, university coverage of care.com memberships. For those of you that are not familiar with care.com, it's an online employment exchange for connecting households and employees, including child and adult caregivers. Important to note that the cost of the care itself is still covered at the individual level. This is for the membership. There's university-wide option there. And a website has been developed with a comprehensive list of resources available, and that's also at the link in the chat. Next slide, please. So we've just finished this year's promotion cycle at the medical school. So I also wanted to share some of the statistics from this year's cycle. Now, as of February 1st, everything's moved to the provost office for final review. And so this shows the promotions for academic year 21 compared to academic year 20. So just noting across the bottom, There were 241 promotions altogether. So it was a record year for promotions, up by 15%. And so just a reminder that although there is still a hiring freeze, that promotions are still going forward, and that now is the time to start working with your department. In most departments, this is the time of year starting about now or through later in the spring, if you're planning for a promotion in September of 2022. So to start that conversation now. Next slide, please. Thanks. So finally, I wanted to review information about the COVID extension year, because we're finding that there are a number of faculty and divisions that are still not aware of this. And in recognition of what an incredibly challenging year it's been, that there is now an extension year option available to any faculty on a timed promotion pathway. So both junior faculty on the tenure track or instructional track, as well as junior faculty on the research track. So starting last fall, the extension year has been available through a request to Faculty Affairs. This requires the submission of a letter from the chair, which can be very brief, along with the current CV. There's also a new policy under review at the Provost's office, and this would be specific to the medical school. And what we have proposed for the medical school is that this would be a year that could be banked and activated as needed, so kind of like an insurance year. It would be a simpler process that would allow a faculty member to request this year directly, so the department would be notified, but it would be even more streamlined and wouldn't require a formal letter from the chair. Again, this is still pending, but at the moment, an extension year can be requested using the current process with a letter and a CV, and those are being processed on an ongoing basis and are being turned around very quickly. And so we are finding that many faculty are still not aware of this, so we'll appreciate your help and partnership for anyone who is on the call today to help spread the word. And I'm happy to answer any questions later. Steve, I'll turn things back over to you.
Thank you, Lisa. One of the promises I'll make to you with regard to Take 30 is that we want to limit it to 30 minutes. We don't want it to be onerous. We want to bring up hot topics and topics that we need to address, followed by some questions and answers. Those questions that we don't get addressed that you submit on either the question and answer or the chat, we will answer it and get back to you. So we do have a few minutes, and I'd just like to open this up for some questions and answers.
So if we can invite the panelists back. The first question will go to Heather. Heather, we received a question about what is the institution doing? Are we working with NIH to get any updates on how we will handle project delays and funding extensions?
So our office, I was glad that that question came in prior to the Take 30. Our office will be kind of spearheading that and opening up conversations. I can share that NIH just recently in the last week and a half announced their fiscal policies for this year, where they reinstated all awards to, or recommended reinstating all awards to their full amounts. Many faculty have received award letters so far in this federal fiscal year that were limited to about 90% of the anticipated award amount. So NIH has made the official announcement that they expect institutes to take that fiscal policy and start to release the rest of the award funds to investigators. So we're happy to hear about that. Individually, institutes have not begun talking about no-cost time extensions or an organized way, I guess is the best way to put it, to share a pathway forward for institutions. So we will monitor that through our office and share that out with the research community as there's formalized information available.
Great, thank you. Lisa, there was a clarifying question that came in on the data that you presented. Was that just for faculty or were staff included in that data?
So for the promotions data, those are faculty data, but for the the Family Care Task Force, that did include faculty, staff, and learners. So that survey went out to all 30,000 employees and trainees at Michigan Medicine, and there were survey respondents from all of those categories to the survey.
Great, thank you. Steve, a question came in that it's not new to you. It said, what is our goal for NIH ranking? Is it top 5? Is it top 10? Something other? Do you want to speak to the NIH rank?
Yeah, so that's a very good question. And what we've actually come down to is that a ranking really shouldn't be a goal. Our ranking should be the result of an output of a constructed strategy with defined tactics to do what we can to facilitate the research which is occurring on campus. And that's what we're trying to do. What we really like to have is to increase our ranking because we have landed on the right strategies. We've developed those right tactics. We've invested in those areas that are pain points for our faculty to make the research go smoother, faster, and to allow you to be more successful. So ranking has in the past been thought of as a goal that we need to reach, but I look at it as an outcome of a deliberate strategy that we're developing. And with that strategy enacted in the right way, the rankings will come.
Great, thank you. And I'd like to invite Matt from Facilities to join us for a question as it relates to, fingers crossed, we hope to hear an update that we might expand density in our research labs very soon, as well as reactivate human subjects research fully. And so, Matt, if in doing that, how are we going to accommodate additional personnel on site with break rooms and that? So if you could speak to that.
Sure, thanks. That's a great question. So medical school facilities has designated and signed break areas across the 2 complexes to the extent possible using our common areas and our lobbies and other shared spaces, including some conference rooms. What's left to help accommodate people take breaks, and particularly in the inclement weather, is to utilize conference rooms within department space. We've had a few groups reach out to us already. We prefer that if you have a conference room that, of course, is not being used now for anything other than clinical or academic purposes, that you reach out to medical school facilities at med.school.facilities@umich.edu. Give us a room number, a building number, and the department, and we'll reach back out to you, redesignate the room as a break space, sign it accordingly, and also ensure that custodial increases their cleaning of the space. Another thing I should mention is we're also looking at opening a couple more doors across the complexes to help ease some of the flow through the areas that are already designated. Hopefully early next week, we'll have some of those doors indicated on maps for people to enter the complexes. And one last thing I should mention is that if you haven't been to the site lately, take a look at your M card, make sure that it's not expired. If it is expired and you're on the medical school complex, please stop in at the Key and ID office at MedIn and have that card replaced. Or if you're going to NCRC, feel free to make an appointment with med.school.access@umich.edu to get that card replaced, and all of your access should be there on the new card at that time.
Great. Excellent information. Thanks, Matt. So I'll probably take the last question to stay true to our time of being 30 minutes, pithy and to the point. We have a lot of questions that have come in around NIH rank and other topics. So we will do our best to address those questions and get that information back out to you in the form of additional information and research news, FAQs, and other things. But it says that here that during the campus webinar today, it was indicated that they're planning to extend work from home arrangements through at least June 30th. When can we expect an update on how this will impact us? So the official Michigan Medicine announcement was through March 30th. I'm sure we're going to align, of course, with the campus. And so we can all imagine and all anticipated that it would extend through the K through 12 school year, just to continue to accommodate the very challenging environment that so many of our workforce are faced with. I think most importantly, what this entire exercise has, not to call it a pandemic and exercise, right? It's been horrible. What this has shown us is that we can think differently about how we work, that we work very productively from home and remote environments. And so it's really allowed the university to step back and think about how do we create a flexible workforce, a workforce that is modernized to 2020s. And so it really is allowing the university to think about how we accommodate a more flexible hybrid working environment. So we'll be working closely with the facilities team to see what that means, but really enabling more people to find a work schedule that's flexible, that allows them to work some from home, some on site, in a way that is mutually beneficial to the organization and our workforce, and accommodate some of the unique circumstances that we find ourselves in, not only now, but as we move forward. So I think you'll continue to get information about how we're able to consider a hybrid model as we return from the pandemic into a new normal of working. So stay tuned on additional updates related to that. So Steve, I'll turn it back over to you to close us out.
Yeah, stay tuned for the next Take 30. It'll be coming soon. Please submit any themes that you'd like us to take a deep dive into, and enjoy your weekend, and thanks for joining us.